Hi. My name is Shmulik. I come from Israel. Since 2007, I was involved in medical cannabis, owned a farm, ran a multi-farm logistical center, and in the last 4 years, I'm doing product development within the cannabinoid treatment field. I came here to talk about the medical cannabis. I was asked to come and talk today a little bit about the background, the history, the future, and the current environment of the medical cannabis. And the first thing I want to tell you that there isn't such thing, meaning that there isn't medical cannabis. There are plenty of active ingredients within the cannabis that serve medicine. However, there cannot be medical cannabis no more than there could be medical oranges for the extraction of vitamin C. And when we say medical cannabis, what we really mean is cannabis components that from source on, meaning from the genetics, through the cultivation, through the bloom, through the post-harvest and through the processing, kept a list of accreditations that made them deemed worthy as active pharmaceutical ingredients for pharma. There is no magic in cannabis itself, and in fact, the way we have been prescribing cannabis up until today has been wrong and will be changing. I want to talk a little bit about the background. All the business, all the development, all the medical treatment, and all the prohibition around cannabis today stem from a UN convention of 1961 called the Single Convention, as you see. The purpose of that convention was to prepare a list of mind-altering psychoactive agents that the UN, and with it all the members of the UN, deemed inappropriate and therefore forbidden in trade, transporting, development, etc. In that convention there were all kinds of exceptions. Holland, for example, deemed it unconstitutional to forbid their citizens of use. Spain written it conditioned to not violating their constitutional rights. However, the world decreed that this list of drugs will not be researched, developed, traded, sent overseas for no reason, with the exceptions that were made. To that proceeded the process that started in the United States in 1939. Many reasons why, could be conspiracy reasons, could be that the cotton people were afraid of canvas, could be that no matter the reason, in 1939, after years that cannabis has been part of the American medical book, cannabis was put out of law. Since then, the WHO has done an intensive work until they graduated in the signing of the UN chapter that we've seen before. And after the UN chapter, every member of the UN had to pass legislation in their states that more or less mirrors the US convention. Now, here was a place for interpretation. As you know, Holland did it differently, Spain did it differently, Switzerland tried for a long time to do it differently, but up until 1991, this was the only way, world approach towards cannabis. I want to make one more note. They also wrote that cannabis is a Schedule I drug. Schedule I drug means it has no use. It cannot help medicine, it cannot help science, it cannot help. It was named Schedule I, and by the way, it is Scheduled I until today. However, in 1991, the first wave of the revolution came when California initiated a medical cannabis bill. It was a very small wave because California is a state, it's not a federal entity, meaning they cannot change world order. However, it was a precedence that a place legally prescribed cannabis to patients. It was a first law. There were many mistakes done, perhaps by default, perhaps by design. Anybody could get a license. Any pain warranted a license. Any doctor could give one. And any farmer who grew cannabis could grow no more than 99 plants. This is a significant part because no matter how many states after California initiated medical cannabis, the first real change came in 2007 in Israel. Israel initiated a medical cannabis law that, in contrary to California, who were afraid of creating Pablo Escobars of cannabis and therefore allowed people to grow only 99, Israel forced the growers that it selected to grow copious amount of cannabis because they have given them a list of patients, meaning every farm that started had to start with about 2,500 patients who consume about a half a kilo of cannabis throughout the year. So every farm had to have the capacity to grow 1 ton and more per year, which forced the farm to invest in technology. And in fact, this was the true beginning of the industry, because when you grew 99 plants, you are a gardener. When you have to grow a ton of cannabis by certificates of quality assurance and quality control, you are an industrialist. You have to invest in technology, and therefore your results are more consistent. And the true beginning of what they call medical cannabis, but it is in truth cannabinoid treatment, began there. After the Israeli law, the first European law to be thought of was the Czech law in 2011. I put this one in as an example of how legislation sometimes can hurt the cause, not only helping her. In the Czech Republic, 93% of the parliament voted for the law. Among the 7% who voted against was the Minister of Health. He was assigned with writing the law. Therefore, he wrote such a cumbersome and complicated law that until today, 8 years, nearly close to 9 years after, you cannot still get on a constant base Czech-grown medical cannabis out of a pharmacy. And you cannot prescribe it comfortably. The legislation made it so that it will be not feasible to approach. The last change, in between there were 2 more changes. The first one is a country called Uruguay who decided that they're legalizing marijuana. That is contrary to the UN convention that we've seen before, and they suffered dearly for it. Uruguay is a small country. They depend on assistance from the UN, and they were penalized with cutting off support for agriculture, boycotting agriculture export, and disallowing any medical cannabis state to export or import from Uruguay cannabis. The June decision of the WHO was not regarding cannabis, but regarding CBD. Right after that, in October last month, Canada had legalized cannabis for recreational use. These are the major changes within the cannabis, and each one of them has impact. I'm going to talk about Canada towards the end, and right now I just want to talk about the WHO decision on CBD. CBD is the second biggest cannabinoid in the plant. It has a wide area, very wide range of help, and we will get to that. And up until recently, in most European countries, it was absolutely legal. The June decision of the WHO, who was meant to cement it, that CBD is absolutely legal, actually created a small heart attack, a small earthquake, as if a regulator allows a product to be sold on a shelf, in a sense it is responsible to the quality of that product. The health ministry of Estonia cannot let a product that someone cooked in his basement be sold in a pharmacy. You understand, they demand some standards of control. From right after that decision, raids were made in major capitals in Europe to remove CBD products off the shelf unless they were registered already as products, and in Germany as medical products. There's good and bad in it. A lot of CBD that was sold cannot be sold now, but I think the good part of it that we will see in the next coming year an area of CBD-based products or enriched products that will be certified, that will be good to your clients, and it will be spread all over and legal to everybody. The result of all this legislation was that if you look at the United States, you can see that more than half of the United States has been legalized cannabis to some form, and the very most of Europe. When we say legalized cannabis, some have legalized it more. Most have legalized only CBD, the component of the cannabis for consumer purchasing. Now, when we are talking about a full-blown medical cannabis law, if we agree that California was not a good example for it, as it opened the way to legalization and not to true medical treatment, then there is a consensus among the countries that do prescribe cannabis as to what symptoms or what ailments are helpful. Some countries add more, some countries have less, but pretty much this list, and slightly longer, is what cannabis is prescribed for. And when we talk about each one of those chapters, it's developed to sub-chapters. For example, when we talk about neurological disorders, that would include Alzheimer, ALS, Parkinson, etc., etc. When we talk about pain, pain is atopic pain, pain is cancer-related pain, cancer is cancer curing, battling of chemo effects, and other palliative care. You understand that each one of these chapters have various sub-chapters within them. Most countries, when they, in the process of initiating a medical cannabis law, in order to decide what is correct for this country, they take into the consideration indigenous tribe treatment if it exists there. And other than that, they sent a letter to each one of the specialty doctor associations, orthopedic, pain, etc., etc., and consult with them. We want to enter cannabis as a treatment. Would your association have any interest in that? And based on the answers, they write their laws, who is allowed to prescribe and under what conditions. Israel has a rather extensive book that details not only any ailment, but in what phase of the ailment are you allowed to receive it. Not only that, there is a concern, how do you take your cannabis? Now, when we started in 2007, the way to take cannabis was by smoking. There is no denying that the bioavailability, meaning what the body takes and consumes in full as far as active ingredients in smoking through your lung membranes, is the highest. However, in that process you enter monoxide to your lungs, and no respectable doctor should allow you to inhale smoke in order to enhance your health. And since then, since 2007 till today, not only I myself and my colleagues and my competitors, there is a world movement, A, to run away from smoke, and B, to develop what would be referred to in the medical cannabis world as drug delivery systems. Drug delivery system is simply converting the active ingredients within the plant into your bloodstream. And if you are lucky and knowledgeable, also directing them to proper nerve systems, meaning receptors, CB1 and CB2, namely most of them. And so, if we are running away from the smoke, we have other alternatives, and what we try to do with those drug delivery systems, transferring the active ingredients into the blood, is try to adjust to acceptable Western medicine drug delivery system, may it be syringe, inhalers, vaporizers, etc., and load active ingredients into them. What we see from there, we are getting into one of the arguments within the developers within the field. When we prescribe cannabis, what do we prescribe actually? I don't know if you've seen that presentation or you'll see later. One of the lecturers here will talk about specific strains and how they help specific symptoms. And I think he's very much correct. However, prescribing a strain of cannabis to a patient is not nearly enough. First of all, if you prescribe the strain, you again push him to smoke. If you prescribe a solution that comes from the strains, you are not really prescribing the strain, you are prescribing a ratio and a percentage of active ingredients. You follow what I mean by that? If you are telling someone you need to smoke OJ Kush, which has 17% THC, 4% CBD, so many mirrors, you actually given him a list of ingredients, not a strain. This argument, if we should prescribe whole plant or formulation, is based on, I'm trying to find the word for that. I'll go into details. When we smoke cannabis, we get this list of ingredients and we get something more. When we try to analyze cannabis, we get a ratio of about 0.75% on the chromograph that we cannot decipher. We know how much THC it has, we know how much CBD, we know the terpenes, we know etc. There's this 0.75% that is combined of 100 or so agents that each one of them is so minute that it is not feasible. It is possible scientifically, but it is not feasible on an operational base to separate them into agents themselves, which means that every time you buy CBD at a clarity of 99.75%, and there's 0.25% that we're not sure what's in there. We know it's not harmful, it's been tested. We know it's not consistent, that we know, but we don't know what's in there. That little percentage is called entourage effect. It has an impact. It has a profound impact. When you look at a sativa and an indica plant, they have the same values, the values that we know how to read as far as THC, CBD, etc. This small part that we don't know, the entourage effect, is what makes sativa a euphoric agent and indica a sedative agent. So in the argument on whole plant and formulation, people who are proponent of whole plant claim that without that entourage effect, you are missing a lot of the cannabis help. People who deal with formulation say that science cannot call for unknowns, cannot prescribe unknowns. It has to be prescribing accurate ingredients. These two lead the development of products into the market today. As we said, development of product is critical as smoking is bad. And so, the first agent that was found and discovered was CBD. CBD is the second cannabinoid, as we said, in cannabis. It has no noticeable effect when you consume it on its own. And it does a whole lot of, a wide range of effect on the body. Again, we must admit, it does a lot more with the entourage effect than without it. Although we cannot define the exact differences. Now, CBD recently has been described by the WHO a medical substance, and therefore it is regulated. How is it regulated? Depends on the product that you are manufacturing. I will get into that in a couple of slides, but what the industry is now looking is at the next gold rush. We already know the benefits of CBD, and application for that benefits are being developed and produced and marketed as we talk, and we are already looking at what would be the next gold rush in cannabis, as we know they are. Now, towards that gold rush, we are meeting a slew of technical difficulties, but technology develops on a daily basis, and we believe we are going to be there. And what we will see, I will start from the end to the beginning, is if we said that the major cannabinoid is THC, the second one is CBD, after that there is a slew of cannabinoids that are all under 1%, and a whole lot of them are under 0.1%, which makes us technologically very difficult to us to grow them for commercial basis. However, they have unique interests. There are cannabinoids that are immensely affecting in defeating fungus inside the body and outside. There are cannabinoids that can help us control appetite, both in increasing it and decreasing it, except they exist in the plant in a very minor quantity. So efforts are made both in breeding to enlarge that quantity and both in technology to fraction it, to separate it in the extract process from the rest, and develop medicine out of that. And we believe that a lot of those will be as sought after as CBD. The next industry that evolved from that is the terpene industry. Terpenes, up until I believe 8 years ago, were thought to be by many in the industry just an idea of the plant, kind of like our sweat smell on our body, like a body odor of a human, an identifying factor. In recent years, we discovered that the terpene profile, meaning the ratio and amount of terpenes that exist in a plant, serve not only as smell, but also as conductors, accelerators, and contactors to certain receptors and to certain nerve systems. Which means that, for example, when now products are developed in cannabis in the field of female sexuality, in order to bring more blood, more oxygen, and more cannabinoids to the womb area, you have to add certain terpenes to connect to certain nerve systems. So terpenes are no longer just product for the perfume industry. They are true medical agent. We still have problem extracting them in a feasible way. We still have all kind of technology problem meet in our way to us, but this is the way the industry is heading. And for those products to be sold and not to be removed off the shelf like the CBD product we talk, they have to be registered with a list of accreditation and registration. By that I mean, let's assume we develop now a sublingual drop. A drop that you drop 3 drops under your tongue every 4 hours or so. There is a list of products that ends up with narcotic medicine and starts up with the agricole botanical resinol, which is basically a way you can register tomato paste. If you are growing tomato and you're selling paste, you will register it as resinol, but you have to register it. Otherwise, the supermarket will not be allowed to sell it. So in cannabis, the same or other criteria or categories are there. Each one of them has their own set of laws, how you qualify to register, and they have their own set of demands. What do you need? So, for example, if you are a cannabis grower that manufactures hemp seed oil, you will need certain ISO accreditation to qualify your quality assurance and quality control. And if you are selling it as a product, you will need to register your manufacturing via GMP. The same applies to cannabis. You have to qualify in certain ISOs to be able to do international sales. And you have to qualify with certain international trade criteria from GAP to GMP and more. The list is too short, in order to qualify to sell them on the marketplace. This is done, the conspirators would say that this is done so only big organizations can qualify to manufacture from cannabis. Other people say that it is a responsibility from the regulator to protect the clients and make sure that what they buy is quality assured and protected, and therefore they force us to go all through these rings. The impact of those on a financial base is 8 times the cost of the product. Meaning the cost of the cannabis within it is no longer significant at all. If you want to manufacture, the most simple product is the sublingual drops, you need to have 2 second-degree pharmacists on your payroll at full time even if your plant works 8 hours a month. So you understand, all these accreditation has demands that made the manufacturing a lot more expensive. The end of it is that the patient pays for it. I wanted to talk a little bit about the drug delivery systems. We touched about it before. We know that when you have a headache, you are going to get a Tylenol, an Advil, etc., etc. If you have other ailments, there are more sophisticated means to deliver the drug, the medicine, into your body. In cannabis, on its natural base, none of these apply, and that's why we used to smoke it. Nowadays, what we are most concerned about is finding the cleanest and the most safe method to wash away from the outer layer of the plant all the active ingredients to what we refer to as crude, like when you dig oil from the ground, and then purify it by agents, what is called fraction. The ways to do it are various, and they each has their own benefits and disadvantages. However, they do carry some dangers, and this is why the government and everybody is so insistent on the qualifications. The first one is through alcohol, but boiling alcohol through a long time creates a vape that can easily be flammable, or in alcohol flammable. If you use gases to wash the active ingredients, then it's explodable, combustible. And the only way for you to do it properly and leave absolutely no residue is by very expensive machinery, which goes back to the theory of big organization. Nonetheless, we know today how to safely and consistently remove all cannabinoids from the plant without leaving any residue. May the cost be what it is. And after we had that, we can load this API, this active ingredient, into one of those accepted medical drug delivery system. Inhalation through vapors, sublingual through drops, tablets. Tablets is still a challenge because they have to dissolve in your mouth, not swallow them. And therefore the taste is a big factor. Capsules, and each one of them has its own advantages and disadvantages. However, doctors can prescribe them because they can actually account for what's exactly in it, what is not possible in a plant. In the same plant, the top flower and the lowest flower will show totally different values. However, when you prescribe a patch or a pill, you know exactly what ingredients are in there, and you know exactly the dose you are prescribing, one every 4 hours or so, etc., etc. And we are pretty good in the industry in making these kind of solutions, and we will expand them to be a full spectrum to whatever Western medicine is known to prescribe with, will be able to be prescribed with cannabis as well. In looking forward, we see major changes coming. First of all, we are learning that smoke is not only not popular by doctors, but when we are tracking dispensary of legal cannabis in Canada, in Oregon, in Uruguay, less than 20% of the sales are for flowers. All the rest are in products sold. Vaporizer, dabs, creams, gels, popcorn, ice cream, not smoke. Or smoke is decreasing. It is now in Colorado less than 16.5%, and in Canada 21%. Uruguay is a country of smokers, and it stands on 24%. We see states that are initiating medical cannabis laws, but forbid flower altogether, just extracts. We believe that is in order to eliminate the smoke, but we think what they're trying to do is make sure if you extract, then you have to have a laboratory. If you have a laboratory, then you can and you should and you must certify it, and this way we ensure that our patients are getting quality product. We see the development of processing technology, which is important because we said that there are some cannabinoids that we cannot yet feasibly extract on a commercial basis to make business with it. But we see the development and it's promising. What's more promising, we now only, with the newest technology, can mix cannabis with other botanical drugs in order to get an enhanced effect. Up until now, when we developed cannabis product, we used only cannabis. The vaping temperature, the mixture, where it was broken in the stomach, between that and other herbal medication did not mix. Only now, with the developing technology, we are capable of enhancing cannabis medicine with other plants. Same applies to the drug delivery systems that we talked about. Patches will be soon available, so you can get a 3-day patch of cannabis for whatever specific ailment you have. And the main thing, we can grow a lot more cannabis that could have been grown before under correct parameters. When we said that there is no medical cannabis, I meant that. But in order for cannabis to be even a source for medical, it has to be grown under correct quality control and assurance regulation, which is what we call GAP. Today we have vast capacities of GAP and they are growing. And the main thing that will promote the medicine of cannabis is the institutionalization of the database. We have in Israel alone, since 2007, a constant base of 60,000 patients, which means that we had close to 1 million patients throughout the years in and out of the program, that what they received was documented, their responses to it were documented, notes from their doctors in regard their treatment were documented, and all that, along with other countries, is a huge database of how cannabis, in its raw treatment, I agree, affects people, and it is a huge base for studies. Israel now has 17 phase 2A FDA tests run on various tests. It concluded, I think, 21 already. We have outstanding development in area of autism treatment and children epilepsy treatment, and totally separate from that, adult epilepsy treatment. And we believe that the future is just growing. Furthermore, we see entire change happening in the entire medical field, not only as it relates to cannabis and in the area of personalized medicine. And as it relates to us, as we have learning from the doctors we consult with, there are 12 different DNA types of the human body, and each one of them responds differently pharmacologically. And we already know that the large cannabis companies are taking DNA samples from all their permanent patients and log in the data. We foresee the day when doctors will diagnose you not only by your blood type or blood test, they will do a DNA and an RNA test, and correlating these factors will prescribe to you medicine. We see that in our field as well. There is a huge American company who has a facility which they store what they claim to be the largest bank of cancer-infected tissue of human bodies, categorized by DNA, RNA, etc., and they constantly drip different cannabinoids and cannabinoid solutions, meaning formulations, onto them and log responses. Bear in mind that a tissue does not respond like a complex body, but it is a major step in studying personalized medicine, which body type, blood type, DNA type, RNA type responds to what type of cannabinoid or cannabinoid mixture. And so we see the future. I don't want to talk years. I believe it will be 15 years or more. Probably I will be smelling roots by then, but diagnostic for medicine will not be a blanket medicine like take Tylenol, you'll feel better. It will be based on your personal status, as they will track it, and it will be adjusted to the agent. And we believe cannabis will play a major part, as we know that more has not been explored than what has been explored, and everything looks promising. Any questions? Then I will conclude.
Don't run away yet. Ei ole. Jah.
I've read an article that in Israel cannabis is given in some cases to older, not older people in care houses. Is that true? And under which conditions?
As we said, there are 14 conditions in which you get. The last one of them is palliative care. Palliative care is described in Israel a patient who has a life expectancy of less than 6 months. So some of those elders are getting it under that. Others, as you will find out, I hope one day, or I hope not, but you will find out, as you age, you collect a list of ailments. And in time, you will qualify to one of those 14. Your sugar might go out of balance. You might develop chronic pain. You understand? A lot of people at older age are getting prescription, even if they are in care houses. And if they are in care houses, the prescription is being delivered to the care house. In fact, by the way, as 2 anecdotes on that, there was a care house in Israel who saw the same article you saw on TV and contacted our farm. I'm talking, it was 2009, and asked us how to get it. We deferred them to the Ministry of Health, who sent them a letter who told them that due to the unknown impact for long range, they cannot recommend cannabis on blanket cover to the elder people over there. They still don't know what's happening in the long range. That was one. And the second one was that the oldest patient in Israel was 92. And in an interview, she said that medical cannabis made a major change in her lifestyle. In question why, she said because her grandkids never stop coming now.
I have a second question too.
Yeah.
You mentioned some additional plant enhancers for cannabis effects. Can you bring some examples? What plants do you mix together in order to enhance effects?
I will give you a simple example. When women experience menopause, one of the plants that helps them a lot is Siberian ginger. Siberian ginger, along with another plant which I can't pronounce its Latin name, it's called the Abraham plant in Hebrew, are both poisonous, even within a slightly over. However, with cannabis, they are mitigated, and it has been very effective. The problem we had was when prescribing them in a vape solution, they would not vape at the same temperature. So you would never really vape the formulation. The current changes in technology allow us to do it. And so now mixtures of medicine don't have to consist of cannabis only. Cannabis is not a miracle cure. It has agents that do a wonderful job. But when mixing them with other agents, they do an even better job.
Thank you.
You're welcome. Yes.
I noticed you mentioned among ingestion methods something called pumic intake.
Pumic intake
What is that?
is any type of medicine you take through your stomach. It could be designed to break in your kidneys, in your liver, in your...
I guess that is it. Thank you very much, Shmuel. Thank you for a
Welcome.
great speech.